Well, good afternoon, everybody. My clock says 1 o'clock, so I think we're going to go ahead and get started. Thanks, everybody, for making the time to join this webinar. I've personally been very excited for this one. I know a number of you who are participating, but for those of you who don't know me, my name is Jay Byers, and I am CEO of the Greater Des Moines Partnership. Most of you are probably familiar with the partnership, but for those of you who are not, we are the regional economic and community development organization serving Central Iowa, helping lead economic development now in 10 counties, 24 affiliate chambers of commerce, and about 6,600 members. And so thank you for taking time for joining us today. We know it's a rough time out there for a lot of people. There's a lot of uncertainty, but at the same time, we've seen incredible examples of time and time again of Iowans stepping up and doing extraordinary things. And we know that Iowa has a long time history of, again, stepping up to a challenge. And I've said this on multiple calls already today, but I've never been more proud to be an Iowan and seeing how we're responding to a very difficult situation. At the partnership, we've realigned all of our priorities here in the last month to really focus on sort of three things. One is what can we do to help businesses stay in business? What can we do to help keep people working? And then three, what can we do to help keep our community healthy and safe? And that's really the focus of today's webinar. And we're very lucky and blessed to have two of the leaders of the Iowa Clinic who are joining us today to help talk about what the Iowa Clinic has been doing, and these two specifically in terms of on the front lines of the COVID-19 situation here in the DSM region. So it's my honor to introduce them here shortly, but I also want to make sure, number one, everybody puts their phones on or their Zoom on mute. We will have an opportunity to answer questions at the conclusion of the presentation. So you can, any questions you have, just go ahead and put those in the chat function. Angie Stepsis will be coordinating the Q&A at the conclusion of this, and Angie is also an alumni of the Iowa Clinic, which is great that she's got unique insight as well. So without further ado, it's my honor to introduce to you Dr. Heather Mohr and Dr. Jason Mohr, who I believe is a Simpson alum. Yeah. All right, go Storm, me too. So thank you first and foremost for joining us today, but thank you for the great leadership that you have shown at the Iowa Clinic and you
knock it off
as practitioners in what you've done on the fight for COVID-19. So I will turn it over to you, and again, thank you so much for joining us today and what you're doing. I just want to let you know how much we really appreciate all that you guys are doing in the healthcare industry, really putting it on the line every day and really helping in keeping our community safe and healthy. So thank you so much.
Thank you. Thank you, Mr. Byers, for having us. And thank you to Angie and Tiffany for arranging this. My name is Heather Mohr. I've been an internist in the Des Moines area now for around 12 years. I'm actually a product of medical education in Des Moines. I did school and residency here and have been working here ever since. At the Iowa Clinic, I have a few different roles. I am chair of our clinical care committee. I also chair our optimization committee. I work mostly in clinic, but I also have hospital privileges at Methodist West, and then also have privileges at Mercy West. Now I'll introduce my husband, Jason Mohr.
I'm Jason. We don't have to social distance, so we're okay in that regard. But yeah, I've been at the Iowa Clinic for 8 years, native Iowan as well. I practice pulmonary medicine and critical care medicine. I serve on the board of directors at the Iowa Clinic, and I'm also the medical director of intensive care for Unity Point Des Moines. It sounds odd, but for me, this kind of started 3 years ago, or 4 years ago, perhaps, when the Ebola outbreak was kind of growing in sub-Saharan Africa. You know, we were kind of thinking along the lines of what if something like that happened here? And we did at Methodist some drills where you know, the rubber boots on and the big gowns and whatnot, and I was standing there sweating in this room thinking to myself, you know, we knew what Ebola was at that time, and it was a contact virus, And I remember standing there thinking to myself, what if we ever had a pandemic of a respiratory virus, and just how, you know, horrible and tragic that would be. And we all have, you know, our fears in life, but, you know, that was always one of mine. And from a professional standpoint, and to see that come to fruition, to kind of, instead of having your best dreams come true, kind of having your worst nightmares come true, has certainly been an experience. You know, as we started hearing news out of China, you know, I think the easy way to kind of put that in a box is to think, well, we live in Iowa, nothing like that happens here, and almost go into denial that we need to be prepared for something like that. So I think actually, you know, the hardest part of the whole process, at least from, I don't think just our organization, but many organizations, is getting over that initial hump to say, you know what, we need to deal with this. It is real. We can't be isolated from something that right now may be happening thousands and thousands of miles away, because as we have unfortunately learned through this, it only took a couple of weeks to end up on our doorstep. For us, you know, when you're providing healthcare to people, that's pretty essential. But what's made it unique here at the Iowa Clinic is, of course, we want to be available and take care of patients that are suffering from COVID-19, but we still have a lot of other patients that don't, and they have their diabetes, or they have their asthma that still needs to be taken care of as well. And how to manage that, and manage that population while keeping everybody safe and providing the needs that everybody has really made us transform the way we deliver medicine in a very short amount of time. And we've had just extraordinary collaboration, not only from, you know, the departments here in the clinic, but the whole healthcare community in Des Moines, and we'll talk about that a little bit later. I think, you know, in our experience here, we both grew up here, it's a level of collaboration that has not even been close to have been achieved. And, you know, it's very nice to know that we have so many consummate professionals work well together. And like you said earlier, Jay, I mean, it does make you be really proud to be from Iowa and from the Des Moines area. So we're going to talk a little bit today about how we've gone, you know, in 6 weeks from a clinic that was doing its everyday thing to being on the front lines and having to adapt. So I'll have Heather talk a little bit about just kind of how the day-to-day looks around here and how different it is to what it was a couple months ago.
If you will have you advance the slide.
So I want to reiterate the point that Jason made, that we really miss taking care of all of our patients. That is what we're here for. That's our purpose. There's been a lot of changes that have been made quickly to deal with this. And I finally feel coming into work that I'm getting back into a rhythm. It's a new rhythm. Still finding my way a bit, but I feel like I'm getting my feet underneath me. When we come into work, it's definitely a different tone. When you walk into the building, and we can advance the slide again, we have reduced the number of entrances that we have. When you walk into the building, we try to make it safe for patients. Everyone gets their temperature taken, they get screened. We have to log our temperatures every day. After we get into the building, we take a look at our schedules. Our schedules are different. Instead of having mostly clinic visits all day, every day, we now go between clinic visits, e-visits, phone visits. We have a lot of different ways now we're able to reach patients. And that came out of great collaboration with our quality department, our IT department, insurers, so that we're able to continue to care for people that aren't able to get out, and who may not even really be able to access or use a smartphone very well. When we see patients, we separate the well and sick visits. So we see well people in the mornings, sick people are saved for the afternoons. We're cleaning our rooms in between every visit. We have all COVID suspect patients going in through urgent care now. We have a separate phone number, separate triage for all of that. And it's not only about taking care of their needs, but it's also about doing a welfare check. When I do have patients come in, or I do talk to people online, just make sure they're doing okay. Mentally, this has been a lot for people to handle, and a lot different to manage lives on their own if they don't have support, and just making sure that there's nothing else that we can do to meet their needs. And that is not only with our patients, but also our staff and our colleagues. We have phone visits now with all the providers 3 times a week to cover any questions they have about COVID or clinic operations or what's going on with different departments. So it's nice to touch base with everyone, make sure we're all on the same page, make sure our patients and our staff are doing well. And that's really it. Do you have anything to add?
I think, the e-visiting has been, and I say this because strategically this is something we've talked about for years, and tried to move it forward. And when the issue is pressed, all the departments like Heather mentioned, whether it was IT or HR, that was able to get really put in place in a matter of, 10 days. And that's going to be something, when you look back at this, just like when we look back at 9/11 and how did our world change after 9/11, I think a lot of the things that have changed very quickly will be with us, maybe for good. And I think a lot of the telehealth may be one as well. But I think, it's really reassuring to work at a place where when it's time to step up and get things done, they get done quickly, but more importantly, they're not just done quickly, they're done very well. And I've had, every time I get off an encounter with a patient, I think they like being able to sit in their lazy boy or wherever they're at, and instead of driving in here and trying to find a parking spot, which isn't always the easiest. So that's been a really positive experience. Trying to draw those, there's a lot when you look at the news and when you see, the sick patients, there's a lot to be, sad about. But I think looking at things like that and finding out how, this is teaching us lessons on how to make healthcare better, not only now, but in the future. It's important to also have those victories and think about that as well.
Go ahead and advance the slide.
One point we really wanted to make today was just to make sure that our patients were aware that we are still here to meet their healthcare needs. There's a lot of our patients with chronic diseases that still need to be managed. And just to put the message out that we're screening everyone at the door, we're doing what we can to keep people who are in the building safe and healthy. So if you have any questions about that, certainly call your providers. We're always willing to answer any concerns that you have. Go ahead and advance the slides again. The next 2 slides are some information about our e-visits, virtual care, that's available now to patients. And I would say at this point, probably 60% of my days are spent on e-visits or phone visits. And again, patients really appreciate that change in our day-to-day and what we're able to provide. Okay, go ahead and advance the slide again. And we'll do it one more to the COVID slide, yep. So our urgent care has really stepped up and provided services for COVID screening, COVID testing. It's a drive up, so patients aren't kept in the building, they're kept out in their car. Our lab is also doing a service where they will come out to the car and draw blood. We're now taking urgent care visits by appointment. So they have tested a large number of people. We have a process in place to call patients who do test positive and talk to them about what they need to do. Also those who test negative and what next steps are. Okay, and advance the slide again.
So we've been in a part of a big collaboration in Central Iowa with all the healthcare providers, which is, as you can see on the screen, Iowa Clinic, Unity Point, Mercy One, Broadlawns, the VA, primary healthcare. Also with that, the Polk County Department of Health. there's been regular communication, daily between these entities to figure out where are our resources, where are our weak spots, what are we doing well, what can we do better. I know, I'm going to speak a little bit more into, the inpatient side of things, so you can go ahead and advance the slide. I was on call last night, so I actually took these pictures last night. On the left, that's a nurse there in the gear that we typically wear when we go into an intensive care room. What he has on his face is called a PAPR. That's kind of a half helmet type of contraption that has a blower that you can't see that's on the back of him that blows positive air through there, positive pressure, excuse me. So theoretically, there's no aerosols that can get into your face, but to get in and out of that equipment and do it sterilely or cleanly, every time you go check a blood pressure, every time you go check an IV, that's a 15-minute process just to get in and out of that room. And to talk about the sacrifices and the calm that staff both here in the clinics and down in the ER, down in the hospital, nobody knows, nobody has any experience with this, and these people continue to show up to work every day dealing with that unknown, the fear of what may come in that door. And I can't say enough about the community as a whole of people that work in healthcare and how brave they're being and how they come to work and they do the absolute best they can, because it has fundamentally changed how you do every single thing during the day. And that can be really frustrating, and they've stepped up to the challenge. The other, pictures up there are just kind of general pictures of the ICU. The only interesting thing, we have carts outside the rooms now that have all the PPE, and then you see that blue line on the floor. Between the door of the room and that blue line is where you doff and don or put on and take off all of your equipment, so as to not spread it around the rest of the unit. The hospitals, again, from a collaboration standpoint, I talk to my counterpart at Mercy, every other day. There's a physician we talk to up in Ames every other day. It's nice when kind of boundaries drop and we do what we all are here to do, and that's take care of people, and we do it together no matter which building you're in. And sharing ideas and hey, this works for us, this doesn't work for us, I think has really been a benefit to the community as a whole. Because ultimately, it doesn't, when you get sick with this, we want you to get the best care you can get no matter where it is in town. And I think, going into this, we had a really good healthcare system. I've worked in Chicago, I've worked in Kansas City. I would put us up against anybody in terms of the quality of care that gets delivered here in Iowa. And it's, something that we always want to work to improve, but we're also really proud of. And if there's one thing I can kind of say to the general public, I guess, certainly there's a lot of fear, there's a lot of uneasiness about this, but you're in good hands. We have a lot of good people working here in Des Moines that are ready and willing and able to take care of the challenges that come forward with this. I won't get into details, but you hear things on television like, ventilator needs and ICU bed needs. And, when we talk about that, and I'll speak a little bit more to where we work, the ability to adapt and change. And for one example I'll give is at Methodist, there's essentially 9 of us that run ventilators, which in a surge like this isn't very many. And we reached out to a lot of other physicians that perhaps in their residency, and most of them trained here, ran ventilators. And we were hoping to get maybe 5 people that'd be like, yeah, if it gets busy, I'll help. So we sent out kind of just a general email to the other internal medicine physicians in the system, and we got 30 responses, 30 people who haven't, been doing this every day that said, yeah, give me some training, I want to help. Anesthesia at the hospital has been a huge help as well, helping us with procedures and getting patients intubated and things. The surgeons, I mean, the list can go on and on and on. And I think no matter how scary this is, or you wake up every morning and hope it's a bad dream and you realize it's not, but then you think about all the people that have your back in healthcare, and it's really uplifting. I think, like I said, it's really important to try to take time and think, what went well from this? What can we take with this and move forward? And certainly there's been a lot. It's, I don't know. I mean, it's been an experience to go through, and we're not alone. I mean, every industry's dealt with this, but when you have to look at it in the face, every day, it can get overwhelming.
And I would really just echo what Jason has said. The Des Moines community in terms of medical has always been great. And I've talked to all my colleagues from across the nation about how great the medical community is here. I feel like there's so many doctors I could call on the phone. They would be there. They're there to help. I feel very supported. I trust them all with my patients. In collaboration, just to add to that, part of the story Jason's been talking about, within our department, we made plans for surge. What are we going to do? We always usually have 2 people rounding in the hospitals. What are we going to do when, the demand exceeds their capacity? Well, we came up with the idea of having 2 different teams. How would we rotate those teams? What about the people who take call at night? Just walking through all the scenarios, and then reaching out to Unity Point and their hospital team. How can we help each other if the demand gets very high? And then also helping out groups such as pulmonary, reaching out to them. Can you teach us a brief course on, a refresher on vent management? We would be happy to help if that's what the time calls for. I mean, everyone really has stepped up and been willing to do whatever it takes to take care of patients in Des Moines. So just can't say how proud we are of the Des Moines medical community, that's for sure.
And how, I don't mean to keep speaking with cliches, but I mean, it is now more than ever true that every role is important. It's not just the physician, it's not just the nurse, it's the person at the door taking your temperature, it's the person making sure the rooms are clean, it's the security guard, making sure that people who aren't supposed to be in the hospital aren't there. I mean, it is very different, but everybody has just been so responsive, and we've got a long way to go. We're just at the beginning of this thing, but certainly to be here at the Iowa Clinic and be a part of, being agile. We've always taken pride in our ability to be agile when needed, and I don't think that's ever been, or probably never will be, called upon as much as it is right now. And to have the people that Heather and I work with here, I can't wish for any better. And I think that our focus is always and will always be to be able to take care of our patient anytime, and now with the e-visits, even anywhere. And we're getting through. We love to be part of the Des Moines community, and all you on right now that are part of the community. And we've had help before, whether it's professionally or just going downtown and enjoying the things we have. Now it's our turn to step up and give back, and be there for what we need. And I think we're ready.
Mm-hmm. Angie, you can advance the slides. Just want to show you all some of our team members, especially those in urgent care, which is who you see now. We've relied really heavily on the staff in urgent care to help us manage this in the outpatient setting. So just want to recognize those people and go ahead and advance it further. These are 2 of our urgent care providers that are screening patients out in their cars with COVID and seeing COVID patients in the urgent care clinic.
And the cold rain too.
And snow. Sometimes I sweat, sometimes I freeze. And then just want to advance it a little further to recognize people in the pulmonary critical care department for their contributions to managing COVID. And one of the last things we wanted to talk about, if you advance the slide again, to the picture of the windows.
Yeah, I gotta flip through that
one. Would just be how we've really noticed and appreciated how everyone's reached out in terms of the community and patients. You know, it really means a lot to hear from patients and just have them say that they're thinking of you and people in the community giving their support. And these are just some ways in which we've seen that. So that certainly does not go unnoticed. And I know one of the last things we get a lot of questions about, and what we maybe wanted to talk through with everyone, is just, you know, what do you do if you're a patient and you feel like you may have the symptoms of coronavirus, and how would that look? How would you manage that? You know, we have a number you can call if you have symptoms of coronavirus. And from there, you're triaged with one of our nurses. And if it's decided that you meet the criteria to be tested, what happens is that you get on the urgent care schedule and you go through a registration process, and you pull up to our urgent care driveway. They come out and then they do the swab. They'll talk to you. If it's appropriate for an actual visit in the clinic, they'll arrange that as well. You know, we are getting test results back around 48 hours the last time I checked, although has not always been the case. It's gotten a little quicker. And then, you know, we have you stay at home and manage your symptoms unless your symptoms become bad enough you think you need to be hospitalized. And then I'll have Jay talk a little bit about how what happens there with that management.
So yeah, if you need to be hospitalized, obviously go through the emergency department at any of the hospitals in town. Typically, in most cases, the criteria for admission would be if you have low oxygen levels. I won't get too much into the science of this, but the ER has been well adapted and changed to try to limit risk as well. They've taken care of a lot of patients down there that have come in with either suspected COVID or COVID. You know, once in the hospital, I mean, the news has a lot of different statistics they throw at you. You know, it's different for every patient. I know that's kind of a gray answer, but certainly, you know, we've had patients in the intensive care unit. We've had patients that have been in the regular part of the hospital. We've had patients that needed to stay 2 days. We've had patients that needed to stay 3 weeks. So it's clearly a very anxious time. If you are sick enough to end up down there, I think the most difficult part of being a patient in the hospital right now, not just with COVID, but for anything, is that there's really the visitation policies are pretty strict. And that the safety of all the patients in the hospital. And that, again, is where I'll kind of lift up our staff again. I mean, knowing that and some of these patients are really sick, you know, the staff has stepped up and tried to be that comforting hand when the spouse or the mom or the son can't be at the bedside. And, you know, it's a very stressful time. But you've got good people in town that want to help. So yeah, it's in the clinic and the hospital. We'll be there. We'll be ready.
Okay. I think that's about all we had prepared. I don't know if you all have any questions for us.
I don't know who that is.
That is, anyone wants to donate any face masks or any sort of equipment, that's where the drop-off time and place is.
Well, that's perfect. That was actually a question that we had, was if you made cloth masks, what can we do with them? That kind of thing. So I can definitely pass that along. Another question that we had come through was, what can we do that would be helpful to you and your teams right now? Like the general person in the general community, what can we be doing for you guys?
Stay at home. That's the big one. Stay at home. It's been shown over and over again, places that have had success in treating this, their people have socially distanced and they've had testing, but I mean, I think staying at home, trying to limit the spread, that's absolutely the most important thing we can do.
The next question was, how has this affected you? What are like kind of the processes that you go, obviously at home, you know, you guys are both around people that could potentially be contagious. What is the process that you guys go through personally in dealing with this, and how has this affected your personal home and things of that sort?
Yeah. So we are really good about looking at our schedules and making sure that we are not both in the hospital at the same time. For example, Jason worked in the hospital last weekend. My hospital time is coming up this weekend. We're very careful about when we do come home from work, making sure that we change our clothes, wash our hands. Jason, especially being down in the unit and being around it all most of the day, has started to take clothes into work, showering at work before he comes home, changing, that type of thing. But, you know, it is something that weighs on the family. You're always really concerned. You know, obviously no one wants to bring this home and get people in your household sick. So we try to do the best we can to manage it just how anyone else would, but we also really try to take a look at our work schedules and make sure that we do the right thing and separate ourselves out in terms of times we spend in the hospital.
Yeah, and just the normal, you know, like any parents, we have daughters that are 4, and trying to explain, you know, especially when you're down there working, or, you know, initially when I'd come home and they'd come running up and you got to kind of like, you know, let me change. It's hard. It's, you know, because they don't understand. You know, they know what the word virus is and they know they don't get to have a birthday party because of it. But, you know, in some ways I'm very thankful that we're both physicians, so we can talk about it and know where each other's coming from, you know, whether it's our anxiety or frustration or fear or whatever. I think the biggest casualty is I had to shave my beard, so I have this ridiculous mustache now because I have to wear an N95 all day. That's probably the only bad part of it at home anyway. But it's just, I mean, it's just like everybody else. I mean, I think having kids is the hardest part, just trying to explain, you know, why dad's stressed out today or why I was in the hospital last. Those are probably the hardest part.
Got it. Next question was, what are your models telling you regarding the flattening of the curve in Iowa?
That's a good question. So I think the most commonly looked at model is probably that from the University of Washington. For the most part, and this is my opinion, so disclaimer, but as that's come out for the last 3 to 4 weeks, it's typically overshot a little bit in terms of where we should be on that day in terms of what we need. So I think on the front end of that curve, meaning like from where we are until we hit the surge, it's pretty accurate. I think there's a debate though, if you look at that curve or look at most curves, they're symmetrical on the way up and on the way down. And I don't think we're gonna see that. Nobody has really seen that. So that's the one kind of false sense of hope that I worry about when people look at that, is you look at it and goes, oh, well, that curve goes all the way down by June 1st. I don't think we're going to see that. The back half of that curve goes down much more slowly than it went up on the front half. Just, you know, you look at the models, most seem to say that first week in May is when we'll hit surge. And, you know, just anecdotally, I think we're, you know, every day seems to be a little bit busier. I think we're still on the way up. We're not close to a point, I don't think, where we can relax or certainly declare victory or anything. But yeah, we're still on the way up. I think we've got a couple, you know, 2 to 3 hard weeks in front of us.
What do you see as the future of this virus?
You want to tell her? No. I mean, if you look back historically, and again, I'm not a infectious disease expert, but you know, when we had H1N1 in 2009, it was not to this level, but it was fairly devastating. And now that's just part of the flu. You know, and I think someday it will be similar. You know, we'll have immunity. Does it mean you'll be, you know, absolutely in a bubble from catching this? No. But part of the reason that, for instance, flu vaccines, we give flu vaccines not so you're impervious to the flu. And so if you get the flu, your body's ready to fight and you don't end up in an ICU. And I think as we look down the road with this, whether it's 2 years, 5 years, whenever, that's eventually where we'll be with this virus. But it is not going to be tomorrow. It's not going to be August. It's going to take time to get there.
What has been your biggest learning from this situation so far?
Oh, I mean, it's just incredible how things have changed so we can, you know, help people in a different and appropriate and better way for this situation. And just all of the factors and people and the organizations that have gone into, you know, changing so we can all work together and help each other and help patients. It's just, the effort has just been amazing. And you know, I guess to know that we can come together and we can do this has just been awesome.
Yeah, I echo that. I think the other thing is, don't take anything for granted. I think if we pulled 10 people off the street and asked them where the last place they went out to dinner was, most people would probably be able to remember. I mean, those small things that we just did without thinking, you know, it's going to be different for a long, long time. And I think, you know, trying to make the best of the situations, enjoy being with your family every single day, all day long, because things can change. And whether it's here at the clinic or the things we, you know, enjoy in our social life, you know, who would have ever in their wildest dreams 6 months ago thought that we would be in this position, but here we are. So when you have things in your life that are important, you really need to appreciate it and not take it for granted, because it can be taken away very quickly.
I have a few more. How long do you, from what you've read and the research and things, how long do you have to be exposed to the virus in order to contract it? Is it literally touching a surface and then touching your face, something like that?
It's all about viral load. So there's a certain threshold of virus you need to be exposed to, which we don't know the answer to yet. But if there were, for instance, one tiny virion, which is one virus particle, you know, that you had on your hand or something, you know, theoretically that probably wouldn't cause infection. We don't know what that threshold number is. It's much like you look at other infectious diseases. Tuberculosis is the one that comes to mind because it's passed through the air. In the same way, you can be around someone with very mild TB in the same room for, you know, 30 minutes and not get it, or be with someone who has severe TB for 1 minute and get it because their load of infectious agent is so high. So I don't have a good answer to that, but we do know that there is a threshold of viral exposure, but it's more related to quantity rather than time.
And as healthcare providers, how do you feel about resuming business in the community, and what type of time frame do you feel is acceptable with doing all of that?
That sounds like a question for an elected official. I don't know. I mean, clearly testing has to be part of it.
We need quicker testing.
Yeah. There was one thing that, you know, we could go back and change. It would be the capability to test, because ultimately the testing, specifically the IgG testing for antibodies, is going to be very, very important when it comes to figuring out how do we go back to work and get the economy, you know, moving in the right direction again, but at the same time not get ourselves into a position where we could be doing this all over again in a matter of 8 weeks. So it's very, very dependent upon the resources that we have.
And regarding resources, do you feel that here in the local Des Moines healthcare systems that you have the resources that you need, PPE, ventilators, things of that sort?
Yeah, I do. Yeah.
Got it. Do you have any process you recommend to be safe as we order and pick up takeout food? And Tiffany would like to know, for fun, what restaurant food are you craving the most right now?
Oh,
That's a
boy.
tough one. As far as picking up groceries, I mean, we try to stay out of the store and try to do the pickup.
Wipe down your packages.
Wipe down your packages. I mean, most of the stuff, like they say the virus can be on cardboard and those type of surfaces for about 24 hours. So if we can get home and just set it on a counter and let it be for a day, great. Anything that you're going to be touching, and using, wipe off. And then of course, once you're done putting your groceries away, get rid of the bags, wash your hands. Certainly could it be passed, by going to the grocery store and getting it on a bag of chips? Yeah, but the incidence of that is probably pretty low, to be honest. But again, it's easy to reduce that risk to zero just by taking care of it. So yeah, wipe the stuff off, wash your hands. If you don't want to wipe it off, you can leave it sit on the counter. Obviously non-refrigerated items for a day. As far as restaurants, man, that is tough.
Yeah.
Yeah. I don't know. That's too much of a question on the spot. We got it. We picked up a pizza from the other place last week that hit the spot. Something other than food at home. So.
Have you, when you're working at the hospital, do they have the cafeteria? Like, is all of that? How do you guys, as providers, handle that?
Yeah, everything now is prepackaged in the cafeteria, so it's all, if anybody's familiar with the Methodist cafeteria, it was cafeteria lines. Now everything is individually packaged. I think the harder part is like eating it, because I'll take it back up to my office, wipe my desk off, wash my hands, take it out of the package, wash my hands, wash my hands, eat, you wash your hands like 4 times just to eat your lunch. That is frustrating, but it's part of life now.
That is the truth. And what is your opinion on testing? This person said, I don't think I will feel safe until I know if I've had the virus or I can get a vaccine. Do you think all Iowans should be tested?
Yes and no. I'll first talk about the test we're doing now, which is the test for the actual virus. That test is only as effective as it should and could be, is if you're able to go back and trace contacts and isolate. And we're far beyond that threshold here to go back and say, well, who were you around for the last 10 days? We're going to make all of them isolate. So, if we were able to do screening tests on the whole state, that would give us one picture in time of the day those were tested. Just because I test negative today doesn't mean I won't get it tomorrow, and that test is now essentially worthless. The more important tests, and we're waiting to get access to, are the immunoassays, the antibodies, which confer, have you been exposed or do you have immunity? And I'd use that term a little loosely. That will be far more important. But again, we don't know, we're not far enough down the track anywhere in the world yet to know what does immunity really look like with this. How long are you still producing antibodies or still have the antibodies present to be able to fight the virus? I think if we had the ability, certainly, to screen everybody with that antibody test would be hugely valuable. And I think we're all really waiting for that, because that's going to be a game changer in terms of getting life back to something close to normal.
I had a lot of clinic patients message or call and ask to see if we're doing that test yet. So there's a lot of public interest in that as well.
And I think everybody in their mind is like, oh boy, there was a day in March where I felt sick. Hopefully I had it. I mean, I've heard that so many times, and I've thought it too. That would put a lot of minds at ease and kind of give us a better idea. And there's studies out there that, are interesting. Hospital, I don't know if it was the Brooklyn or the Bronx, where they went to the OB floor and ran that test on all the mothers up there. And they found of all the mothers, 15% of all those patients had positive antibodies and never had any symptoms. And I've talked to people that have tested positive, and the only symptom they had the whole time was I couldn't smell or I couldn't taste. So I do think there's a very significant amount of people out there that probably do have antibodies formed to the coronavirus that didn't have, they were the asymptomatic carrier.
How long is testing taking now? For the results, I should say.
About 40, I would say on average 48 hours. If you're critically ill, like on a ventilator, the government is starting to make the rapid tests more available in very small numbers. Those at the fastest can come back in a couple hours. There's also some other tests that are available for inpatients that are within 24 hours.
Got it. That is, oh, there's one more. Do you think there is a serious threat to the food supply?
Yeah, I mean, certainly with what we've seen the last few days, it's concerning, especially in Iowa where we produce the pork that now they're not going to be able to process. Do I think they're, you know, are we going to have a famine? No. But are prices going to probably change? Yeah. And when in a time when nobody or a lot of people aren't working, that is painful. So yeah, I do think it's going to affect it in terms, not so much of maybe availability, but certainly cost. That was from my minor in economics in college, and I came up with that answer. So at Simpson.
Is there anything else you want to share with everyone? We cannot thank you enough for all you're doing and for doing this for us. It's very informative, but anything else, because a lot of people are going to watch this after the fact, that you would like people to know?
I would just say thank you. I mean, I know it's been very hard for everybody to live through this, and you know, to stay at home and try to reduce the risk. That helps all of your fellow Iowans, but it also helps us. And you know, thank you for making the sacrifices that need to be made right now. And we'll get through this. We're going to work. Like all the memes on the internet, you know, I go to work for you, you stay home for me. We'll be there for you. We'll be there.
That's great. We really appreciate it. If there's anything in the future we can do, we appreciate the Iowa Clinic as well. But we're thinking of you guys.
Thank you.
Thanks for having us.
Thank you.
Hey, no problem.